items. If you are on the phone, use *6 to mute and unmute yourself. And we will take questions in the question bar at the bottom of your screen on your panel on the right-hand side. We will be holding questions till the end of the webinar. So this is our weekly Chicago COVID-19 webinar. We've been alternating peer sharing webinars and all Chicago DFSS CDPH update webinars every other Friday. Today is the last day that we'll be using this alternating format. So going forward, we will have a different frequency for both the peer sharing and the all Chicago DFSS CDPH updates. So please stay tuned. We'll be sharing information via email about when those next webinars will be taking place. Peer sharing webinar goals are to dedicate time to share questions, strategies, resources, and work towards common understandings. So our topic today is the intersection of Housing First and COVID-19. We'll start with a brief overview of the key elements of Housing First, and then we'll talk about how the Expedited Housing Initiative reflects this model. We have a panel of housing providers with us today, and they will be discussing how COVID-19 has impacted Housing First implementation at their agencies. And so I'm excited for this topic today because, as we know, there are a few things that COVID-19 hasn't touched or changed or impacted in some way. And so it's good to discuss how Housing First has been impacted by this as well. So the key elements of Housing First are to have immediate access to permanent housing options without housing readiness and supports, without housing readiness requirements, individualized and client-driven supports, community and social integration, and a focus on housing stability. So I'll go into each one of those just briefly. So the main idea with removal of housing readiness requirements is that the idea is to quickly move people into housing. So not to require any readiness or place any barriers or requirements that will keep people from being housed unnecessarily. Once people are housed, the underlying issues that contribute to homelessness can then be addressed. So this means believing everyone is ready for housing and not screening them out based on factors like income, substance use, records, treatment, or behavior. Housing First approach compels us to understand people as unique individuals and to create a person-centered solution to individual and specific housing and service needs. So different people will have different paths. And with Housing First, people are encouraged to have the agency to select the supportive services that they need and want. And service providers then tailor their supports to each person's unique situation. Housing First employs an understanding that everyone's housing stability is impacted by their social and community connectedness. So agencies work with their participants to connect them to their community in ways that are meaningful to them, and people then become part of the communities where they live. Focus on housing stability. So Housing First does not end with a person signing a lease and entering a unit. Maintaining housing is also a very important part of that approach, and it involves supporting their success as a tenant, having staff oriented towards keeping people in the program and not exiting them when a challenge arises, working on eviction prevention efforts, and also working on tenant education about rights and responsibilities. At the community level or system level, a Housing First system is one in which everyone has equal access because there are few or no barriers to housing entry, and the system prioritizes people with the highest level of need instead of serving on a first comes, first served basis. Characteristics of a housing first system are that there is system alignment throughout agencies. All the agencies support the belief that everyone is housing ready. There's a community-wide coordinated entry system for matching people to the appropriate level of housing and services. Policies and procedures throughout the system are aligned with the approach, and collaborative decision-making is used to plan and raise resources. So that is the high-level Housing First overview. And now I'd like to welcome Karen Kowal, Director of COC Programs at All Chicago, to talk about Housing First and the Expedited Housing Initiative. Hi, Karen, are you there?
I'm here, just Jennifer. I almost forgot your name for a second because I was listening so intensely.
Well, thank you for being here today. And can you give a brief overview to describe what the Expedited Housing Initiative is in case anyone is not familiar with that?
Sure. So the Expedited Housing Initiative is really the broad initiative that All Chicago and the community have implemented regarding COVID-19. And, you know, there's been different aspects to it so far. So the first aspect was you know, changing the prioritization to focus on the most vulnerable to COVID-19, and then putting some of the accountability measures in place because we wanted to ensure that the system remained a housing first system, which I think by and large it has. And then, you know, at first we were all just kind of getting used to this new normal and understanding COVID and understanding the needs of everyone that is in the homeless system. But, you know, we're getting to a point of recovery, right? And with recovery, it really is the emphasis on a rehousing strategy. And so a lot of the work that we've been doing in All Chicago, we lovingly internally call it the Little Expedited Housing Initiative, is really this broader rehousing strategy to ensure that we're keeping as many people safe and protected from COVID-19 and of the homeless population that we can, right? And so there's been a lot of planning, but there's also been a lot of implementation. And I think the core part of the Expedited Housing Initiative is trying to house people more quickly, to centralize certain aspects of the system in order to ensure that things can move faster, and then like putting people on a rehousing path that makes sense. And so some of the ways we're doing this is centralizing a lot of the landlord engagement that will be around a lot of the new CARES Act funding for rapid rehousing. So All Chicago has been doing a lot of work of landlord engagement and bringing landlords on board and having units like readily available for people to move into. The model of how we move people through the housing process is another innovation that we're trying to test through what we're calling accelerated moving events, where we identify a cohort of folks who will do a lot of the stages of getting into housing in one day, and then hopefully be housed quickly after they're approved by their landlord. So we've tested a couple of these events at Hotel 166 because they were the defined population of the previous prioritization. So, you know, people went through the stages of having their intake paperwork checked. They picked units, they picked furniture from the furniture bank. Some of them had an income assessment either with SOAR or with an employment navigator. And then their day finished, right? And then we sent the housing applications to the landlord and waited for them to be approved, and moved, you know, quite a few people in, signed leases, had quite a few people moved in from that population. So really the initiative moving forward is expanding that to encompass the about $16 million that's been allocated for rapid rehousing through the city. And so really taking these accelerated moving events on the road and having them go at shelters, at encampments, at drop-in centers to move as many folks as we can who are high risk for COVID, because the testing piece is no longer a factor into housing. And then really leveraging our existing rapid rehousing partners for the services, but then expanding that to other service providers to provide case management and stability for people to be housed over the long term. And some of the folks going through the Expedited Housing Initiative, we're treating everybody equally, but some of them, their path will be to PSH and transitioning them onto another subsidy. So we're bridging people to PSH. We hope to we'll bridge people to other subsidies, hopefully through CHA and other things like that, because we know affordability is an ongoing challenge in our community. And then other folks will be, moving and being successful on their own, either taking over the lease, having a roommate, and all those other things. So we've really been working with the rapid rehousing providers to not necessarily expand, but like that these housing plans are a lot more detailed and maybe nuanced than they had in the past, and a lot more folks will be targeted for PSH than we typically see in rapid rehousing, because we currently see very few transfers between rapid rehousing and PSH, and so there's a lot more bridging happening. So kind of like changing our perception of bridge as part of the Expedited Housing Initiative as well. I think I talked way more about that than I had intended to, so sorry about that. That was, for some of you, that's probably the most in-depth explanation you may have heard. So.
Yeah, we appreciate that, Karen. It's good to have an in-depth understanding of it. So can you tell us a little bit about how it reflects a housing first approach? Or do you think it reflects a housing first approach? And if so, how?
Yeah, I really do think it does. I think that, the idea of identifying people in a cohort is very different than how we've been doing like single matches in the coordinated entry system. And I think our experience with the hotel really showed that we were really agnostic about who went first and who went second. Like we literally met with 30 to 45 people on a day, and it didn't matter where we thought they would go in the end. We just knew that they all needed housing. We relied heavily on the great team from Lawndale Christian, who was providing the services there, to identify the people who would be moving, because some of them couldn't move for medical or other reasons. And so, but like, as someone who was on the ground at the Accelerated Moving events talking to clients, like I had no idea where people were going to next, right? And so it was really just this conversation about how we can help them choose a unit, move into a unit, and keep moving forward in the process. Rapid rehousing in general, like the regulations are very low bar. Basically, you have to be literally homeless, right? There's no disability requirement. There's nothing like that. So we didn't need any of those things. So in that respect, and I think for the rapid rehousing case managers, like they're really taking that pure housing first approach and meeting people where they're at and figuring out what their plan is, right? Because they have to work through that with everyone, whether they know from the beginning whether they are PSH targeted or something else. And so I think that kind of taking that mentality of, I'm just going to help you get where you are, and it doesn't matter like what your barriers are and what's happening to you in order for you to get there. I'm going to move into challenges, Jennifer said anyway. But I would say the challenges we've experienced are not unlike the challenges that you've all experienced, which, the project itself is housing first, but the world we live in is not housing first, is how I would say it. And the challenges we have encountered are the challenges you encounter with landlords, right? That landlords want an ID. They want to do a background check. They want to do all these things that slow the process down. And for some people, they are legitimate barriers. I think that, and that's just more learning and more pivoting on how that can happen. I think that we've had to educate a lot of landlords about the just housing ordinance, right? And that they can't reject someone for things in their background that are past a certain time. And so, and then working with affordable housing providers, I'd be remiss in not saying that there's some challenges. I hope that's not my background noise. Affordable housing and tax credit buildings, that financial structure is very challenging to house the homeless population. The documentation burden is high, and the ability to reject someone is clear, and so we've experienced a lot of the challenges you have, but that's not because lack of our belief or our partners' belief in housing first. It's educating and continuing to educate landlords on that, and also our plans moving forward are to be more targeted, right, and understand more upfront about what landlords will and won't do. And so when we're showing possible units to a client, we're really showing them units that we think they're going to get into, right, and not have this hope that they're going to be approved for something and then have the landlord say no, or like have more honest conversations about what things in their background could really stop them from being housed, and just so they see a more seamless process of helping them work through, instead of feeling like they're getting rejected all over again. I would say the other challenge that we've been having because of COVID is like this community piece, and like having the diversity of different communities where we have units available. So I think we want people to live in a community where they want to live in, and that's the housing first ideal. But it's been challenging with COVID, right? Landlords, also didn't want to go out and show their units during COVID, or, we were ready to do our first event and there were mass protests throughout the city of Chicago. And is it really safe to do that sort of thing, or have people move into a new neighborhood that we know isn't, settled? So, I think from the respect of community integration and that piece of housing first, we've had to limit that because of the health crisis that we're in. So I think that's a challenge to that, but we've tried to adhere to choice as much as we can.
Thank you, Karen. So I think we'll go ahead and bring in our 3 panelists to help weigh in from the service provider perspective. So I'd like to welcome Sherry Allen Reeves, Associate Director at Matthew House, Betsy Carlson, Director of Youth Programs at the Night Ministry, and Debbie Culpepper, Director of Grants and Contracts at Featherfist. So we are so pleased to have the 3 of you here for this discussion. And starting off for you, could you, Debbie, could you start us off by letting us know what kind of adaptations have you had to make in order to support a housing first approach during this time?
I think first of all, I should find out, can you hear me?
Yes, we can hear you now.
Great, perfect.
There is some feedback though. Are you connected?
I can turn my phone off because I'm getting feedback. So I'm good now. Okay, great. Clients continue to be matched to Featherfist programs through PSH programs as they occur. However, initial interviews were conducted over the phone, and clients were no longer required to complete intakes in person at the agency's office. The clients were encouraged to provide whatever identification documents they had access to, but were told they were not required to produce birth certificates, state ID, social security cards, homeless letters, or disability verification prior to viewing units or enrolling in scatter site projects. If a client decided to accept an SRO unit at our one SRO facility that we have for single adults, the staff would contact the appropriate healthcare providers and homeless organizations while initially accepting self-certifications and CES assessments and HMIS printouts as proof of eligibility. We try to make it as easy as possible for people to get into housing without without a lot of additional stress on them. There's already enough stress on them as it is. So those are some minor adaptations that we made, but we've tried very hard to make it as easy, simple, and convenient as possible for clients to get into permanent housing. Okay.
Okay, so Sherry or Betsy, do either of you Have you done similar things or tried other approaches to adapt during this time?
So yeah, Matthew House has done the same thing. I think that one of the things that I learned late in the game is about the HUD waiver, right? To make that a lot easier as far as the requirement of certain documentations. I think that, you know, just automatically my reflex was like, oh no, another form I got to submit to HUD, and didn't really grasp like the importance of that. So upon doing that, and then even once you do it, it is also having that conversation with your staff to remind them, because it's a habit to ask for certain documentations. It's something that you routinely do to make sure you have the files in order and have that documentation in place. And so it's really like, okay, we can modify it this time. We can make some changes right now and still work with that client to be able to get that documentation at a later time. But I think that was probably the hardest adaptation we had, was just changing the minds of the staff, right? Having that mind shift and knowing what you can have as far as documentation in order to have somebody move in. And I think that it is probably something that a lot of providers are dealing with, because we are so used to, and even sometimes I just want to be real, sometimes we're afraid of what that audit is going to look like if I don't have that piece of documentation in place. And so there's some to that we are oftentimes resistant to not having coming in on time. So I think that's one of the things that we made the most adaptation about, is just really making sure that we got that documentation, or if we didn't, we noted that it was going to be forthcoming. And that's all I have to.
Betsy, do you have anything to add to that?
Yeah, no, I mean, not a whole lot. So we don't have any permanent supportive housing. So like we have a number of different youth shelters and some youth transitional housing. So similarly, we tried to move as quickly as possible with our transitional housing program to make sure that we were drawing names off of CES if a unit became available. We didn't have a whole lot of turnover during that time, but we were able to, like, kind of thinking about, housing first and even just kind of what is most accessible for people. We did have some people in our transitional housing programs that were able to shelter for a period of time with family, where they would have a little bit more ability to be more isolated, because even our transitional program is a congregate facility with separate bedrooms. So we were able to kind of offer that to people, where it was housing that was comfortable in the midst of a pandemic. So, and I know even within our shelter programs, a lot of our case managers and other folks doing intake had a lot more successful diversion conversations than what they were having pre-pandemic. So it's something that we've been trying to implement more, but I think it was something that more clients were more receptive to as a part of the pandemic, knowing that coming into shelter was a congregate situation. And so, depending on the person, sometimes that was a little bit higher anxiety. So we were always functioning from a housing first perspective, but we've kind of layered on some of the, kind of accessibility of the housing for each individual and their level of comfort with what's happening with the pandemic as well. So we also, with our emergency shelter, we, across the city, we all went to 24/7 operations. And so that meant that for a lot of people, instead of having, not knowing whether or not they had a bed from one night to another, because they were 24/7, if you stuck around, then you were able to actually have a more predictable bed. So I think it actually did provide some more stability for some of the emergency shelter clients, which was great.
So that those are all really interesting points in terms of the importance of continuing to house people and do it quickly during the pandemic. I'm also wondering, with another big part of Housing First being like individualized and tailored services, that you provide them once they're in your program in order to keep them there and keep them successful. Has COVID-19 impacted levels of engagement with program participants and impacted that ability to be person-centered? So Sherry, I'm wondering if you could start us off on this one.
So for us, like in our supportive housing programs, of course it has, right? When our case manager has gone out to do home visits, some people don't want you to even come into their house. And of course, masks as well, but they just don't want anybody coming into their house. And so that has been, in fact, we, a lot of our participants did not have the technology to be able to do virtual home visits. So we weren't able to like say, oh, call me and we'll do a virtual visit because they lack that technology. And so, but if they were to come into our center to get services and person to person and without, any problems at all, I think that oftentimes we noticed that like around the first of the month, we got more people coming in to pay their occupancy fees than we ever had, like because usually they're mailing them in and all that. People wanted to get out to do something. And so at least came in and said, hello, this is my fees. That was something that they got to do. And they were like, they were glad they got out of the house at the beginning of the month. And so that was really that was a difference. Like we were seeing a higher level of people not mailing it in. And I thought it would increase by mail. But people wanted to just come in so they can get out of the house and see somebody, let you know I'm still here kind of thing. And I think that was really good. I know also in our drop-in center services, we had a lot of people who were coming in, particularly early on, they were coming in consistently every day just because they wanted to have a place to be. With everything closing down, they couldn't go to libraries, they couldn't go to McDonald's and sit. They didn't have any other place to sit. And so having that place to be somewhere that you were going to get 2 meals and be able to take a shower was something that they really found beneficial to them. So that was really good. And they could get somebody to talk to about getting into housing because that was just really important to them. And we were able to really help navigate some of that process. And I think I just want to add kudos to the city for adapting the 311 and the mobile team being able to come to alternative sites.
Some necessary documentation.
I think that's really phenomenal. People were able to get picked up from Matthew House, which is something I have been beating the drums on for years. So it actually happened as a result of COVID and has worked. And we were able to get more people into shelter. So those kind of things that made the person-centered services available really enhanced it, even, as we're dealing with a pandemic. Thank you.
I just want to mention we're hearing some feedback, so if anyone in the audience is not muted, please mute yourself. Thank you. So Betsy or Debbie, do you have anything to add to about levels of engagement?
Sure. I think I would echo a lot of what Sherry said. I think a lot of our clients also were, kind of seeking ways to be able to connect with people. So like, for instance, at the beginning, when we kind of figured out ways to do case management virtually and things like that, we actually did have reasonably high levels of uptake on that. And for some people, it turned out like throughout the course of the pandemic to be really great. Like case managers or other staff were really able to dig in with people, even if the staff was working from home, to connect with some individuals. But then we also did actually have some people who, over the course of the pandemic, they kind of realized that virtual was hard. And so they would, kind of even avoid the virtual connections. So we kind of have experienced a little bit of the two extremes of like, this is perfect for me, or this doesn't work for me very well. So, and it was similar with even being able to kind of connect people to some mental health services, where a lot of the people who were connected were really able to kind of remain connected and get good telehealth support. And then with others, we struggled to get them an appointment, or if they weren't already connected, they were like, well, what's the point you know, it won't be in person, so it won't be effective. So it was like, we've really had kind of the two different extremes with it, but we, over time, we've kind of developed different levels of programming to be able to help young people at our different facilities connect with one another, as well as with some of the remote staff. And now that things are a little bit more open, we're looking at ways to be able to kind of start some activities and things that maybe are in person right now, and then that we're hopeful would be able to move online if we were to have another stay-at-home order put into place, so that people can remain more engaged with one another across sites. So like continuing to build some of that community, and you know, kind of the community engagement that Karen was and you were talking about, Jennifer, because like a lot of our partners that oftentimes we'll refer people to haven't been available for youth. You know, like if they were accessing after school programs, or even some of the drop-in centers have had really reduced hours. And so kind of finding new ways to develop some of that engagement and connection has been one of the challenges that we've really kind of faced. So, but you know, we're working to try to be able to figure it out. It's a learning curve for all of us, right?
Right. Right. I just want to say that from April 1st to June 30th, it was difficult to locate clients. We had kind of lost touch with them, or maybe they had lost touch with us, because some of them who didn't have immediate access to cell phones were used to coming directly into the office, and we weren't really, you know, having direct people coming into the office. So it was difficult to locate. And then once they were located, sometimes we lost contact with them. We weren't able to reconnect, you know, once it was, you know, time, you know, to start meeting with them, we weren't able to reconnect with them. The other issue was, once we were able to connect with clients and they were matched, there was difficulty actually seeing units. Housing providers weren't having in-person viewings of units, and prospective tenants were uncomfortable selecting a unit that they were used to actually going and looking at the place, going to the neighborhood, seeing what the neighborhood was like. And it took more attempts at getting used to this virtual viewing of a unit in order to get residents comfortable with doing it that way. In addition to, they didn't have access to smartphones. Some of them that did have phones, they didn't have modern smartphones. So it was, and if they did, they didn't know how to maneuver, how to get in there and do it and stuff. So there were a myriad of, you know, little things. There were lots of stuff, but they were small things. So that kind of delayed the process in actually getting people housed in a timely manner. But it's a learning curve, you know, and as it happened more frequently, we learned how to get past it, and it ended up getting done. But it did kind of impact the level of engagement, you know, to a certain extent. Okay.
Thank you for sharing. So we'll move to our next question, which is, has COVID-19 impacted housing stability for participants at your agency?
Can I say heck to the yeah. So, I will say, Jennifer, and I'm sorry for just jumping in, but housing stability during this season has been something. We've had more people to relapse and having more behavior issues as it relates to, and it may just be because people are dealing with the stress, the anxiety, the not knowing, having relatives that have been impacted by COVID and maybe have even had died, or and if they've been impacted or they tested positive, they can't see certain people, or they're being ostracized because they have or haven't. And it's just anything that it's just grown. It's like and people are really having a reaction to it, which is causing difficulty in their housing because then they're acting out. We've got more, the uptick of calls from landlords who are experiencing some of the behavior issues. People are fighting, or, you know, somebody was drunk or whatever, and it causes problems. And, you know, we value our relationships with our landlord, so we try to do as much as we can to ensure that they don't have problems in their housing, in their buildings. And so we have to go out and have conversations. You know, fortunately, some of the treatment programs are now, we're taking people in now, so they were even able to go to detox or go into treatment because it was getting problematic. But I think that one of the things that is really glaring within our city is that there's a lack of services for mental health or behavioral health. And so we are finding that is more problematic. I mean, like, particularly on the south side, we're just trying to figure out where we can send somebody for some behavioral health services, because it is a real issue. I mean, people, you know, they're dealing with something, they're dealing with stress, they're dealing with anxiety, and
Right.
it is calling for reasons for people to have their housing unstable. And I just want to say that we haven't made an effort to put anybody out, but we have to just really look at, it is causing instability, right? And it could possibly lead to the landlord requesting that. And that's something that we don't want to get to. Thank you.
Thank you, Sherry. And Debbie or Betsy, do you have anything to add to that?
Basically, in our PSH programs, there was a pretty good level of stability because they were in PSH housing. Their rent was not threatened in any kind of way, and they felt pretty comfortable about being able to stay there. Mostly what we found out were people they felt very isolated. You know, because of the level of violence in the city, they weren't anxious to go out and go shopping and purchase groceries and things that they really needed to have. And they were, those who were used to speaking, you know, or seeing their case managers on a regular basis were kind of feeling a little isolated. So what we did at our office was manage to have everyone's desk phone forwarded to their cell phone, so that in the event a client didn't have their personal cell phone number, if they called them at the office, the call immediately went directly to the case manager so they could get in contact with them. That, you know, once people found out that that was possible, they kind of stopped calling because they knew they were going to be able to get in touch with someone. So, you know, the case managers have tried very hard to see that their clients have adhered to the CDPH guidelines, and they have been doing that, checking up on those who take medication, trying to make certain that they are taking it. It's difficult to get appointments with doctors right now, but they are there to middle manage as much as possible. So, there really hasn't been a lot of difficulty in our PSH programs with housing stability. It's been pretty good.
Can I add to what Debbie said? I just want to point out something, because I think that this was a really good comment about the access to groceries. I know that early on, as it related to not only just COVID, and then we had the George Floyd and the Black Lives Matter protests and things happening, and the riots and all of that. And I think that also had an issue with people maintaining their housing, right? Because it was, there's so much instability within the community. You know, I live in a community that still doesn't have a full service Walgreens, right? And there are no grocery stores. And so, and it's on the south side. And so there are more where it had already been, people had already been impacted by food deserts. Now is more, right? It's just like, there is none. It's just a desert. This is, you know, and with the exception of maybe a liquor store or two, right? And so I think that people are now trying to figure out where else they can go, which is having them even want to leave out of their apartments and go somewhere else and stay somewhere else. And so I think that when I look at housing stability, I'm looking at, is it a stable place for me to be, right? For if it you know, inside my house or even outside of my house. And I think that that's what sometimes people are facing, just that stability is like, even if this is a safe community for me. And the thing about this is what I'm clear about is that it doesn't just affect the people that we serve. It affects the people who do the survey, right? So I'm impacted as well as they're impacted. And we live in these communities that have been impacted by COVID. There are higher rates in certain communities on the South Side than other communities. And so that has an effect on our psyche and our ability to manage it. And if somebody wants to go to work, which means that they may not have an income, which means that it may impact their stability. We know as service providers that we're not gonna, you know, evict anybody or put anybody out because of their inability to pay rent at this time, but they don't know it, right? Because they're so afraid of being homeless again that they don't know it. So that's causing the stress. Just the idea that they cannot pay their program fees brings on a level of anxiety because they're fearful of being homeless again. Thank you.
Yeah. I mean, I think I echo kind of what we've heard from both Sherry and Debbie, even though the Night Ministries youth programs are primarily shelter programs. I mean, we've, similar to what Sherry was mentioning, like we've seen an uptick in, you know, some of the manifestations of behavioral health issues with some of our clients and even with our alumni. I think along with what both of them have said, we've done throughout the course of the pandemic, we've done a lot more outreach to a lot of our program alumni just to find out about their stability, knowing that we have worked really hard to be able to provide that stability within our shelters, but recognizing that for a lot of youth, they've, you know, moved into community housing, independent housing, and, you know, are often in some of the jobs that were likely to be changed, or if they have somebody who in their household that would be impacted by them being essential workers. You know, we had a lot of people who reported that they lost jobs. So and or were in neighborhoods that lost some of the food stores that were available. So for instance, like we did things like providing food boxes for some of our alumni that were, you know, curbside drop off to try to help with the housing stability piece, knowing that eventually some rental assistance would come. Just this week, it's finally come. But, you know, like we didn't have hundreds of dollars to be able to help people, but we did have, you know, ways to be able to kind of coordinate food so that whatever cash people did have could go toward things like rent and some of those kinds of things. So, you know, and some of it, and reaching out to people to make sure that there's housing is stable, whether, you know, they may be in a tenuous situation that, you know, sometimes cause them to bounce from couch surfing to shelter to back to family, things like that, like making sure that we were kind of aware of where things were going, because it was harder, it's been harder to bounce. And so some people who are used to that, you know, really trying to make sure that they are able to kind of stay in one place a little bit longer, because some resources are less available right now if you're accessing them really short term. So so it's caused us to, you know, have new conversations, I think, with folks, both within our programs and alumni of our programs in new ways.
Thank you. So we are nearing the end of our time. We have about 8 minutes left, and I want to leave about 3 minutes for audience questions. But I do just want to hear if there are any other successes or challenges that we haven't touched on yet that any of the three of you would like to bring attention to. Related, of course, to, again, this intersection between Housing First and COVID-19.
I will add something. You know, Matthew House is also, we have permanent supportive housing, and we also double as an assessor site. And as a skilled assessor site, we also then sometimes have to do the navigation and helping people get access to that permanent supportive housing. And so I know that like all providers are not equal, right? So we all do different things different ways. And I just want to say that sometimes it is difficult because of the fact that how people are working. It has been difficult, I should say, because of how people are working and getting people access to the housing, right? So just, an email may get delayed a week or two because somebody's working out of the office, or they're not working, they don't have access to their emails, or whatever is going on in organizations. And I know like Matthew House, we had, we were moving things around here. So a week went past when we didn't have access to our emails either. So I just know that sometimes that's problematic. And I think that we all need to give each other a break. You know what I mean? I think, like we know that there's a system in place to really get people housed. And we need to figure out how to work together, really, like really what conversations we need to be having with our peers to make this move smoothly. And I think that oftentimes as a provider, we often look at other providers and think that we can do something better than they can, or they're not doing this right. And I just think that they're just not doing it the way I do it, right? And there's an opportunity to learn and look and listen and be with that provider, and because we can all learn from each other. And I think that this is one of the things that I'm learning because of this COVID season and how we do this housing and getting people in housing first, that it's all inside of how we communicate. It's a conversation. And I think that oftentimes I know that there are certain housing providers who don't adapt to the housing first model, right? And somebody may get matched to their agency. How do we work collectively together in partnership to make sure that that person still get housed, right? So what can we do to reduce some of those barriers to, Social Security is not opening. So what can we use in lieu of a Social Security verification of their disability or Social Security card? What other means of information can we gather? Or can that be just the one thing you wait on? And just be in those kind of conversations to have it work, because ultimately it is not about me as the provider, it is really about that person who's experiencing homelessness right now. And I think that sometimes we don't keep that in the forefront, that this person is homeless, right? And we need to figure out any way possible, by any means necessary, like Malcolm X would say, to get that person housed. And that's just what I want to offer. I think that has just come up more and more for me. And it's difficult. I mean, we've had difficulty getting people when we match, finding that person, where are they at now, if they are one, with our current HMIS system, there's hardly any way to find out where that person really is now. Like if they're in a shelter, if they're at this shelter or that shelter, there's no way to see it on the timeline. So it's difficult, maybe difficult to find that person if their information is not current. And we need to give each other a break, right? So that we can say, okay, we're still working on that. We're still doing that. So that's just all I want to add, because that's been the biggest barrier, is one, finding people and where they are at. If they're at Hotel 166, that wasn't on HMIS for a long time. Didn't know where the people were. Now I just saw it a couple times on one of assessments. I'm like, oh wow, there it goes, it's on there now. And so a miracle happened. But they're finding people and then being in communication with my colleagues to say that, hey, I'm having a hard time over here. What support can you offer? Or even, I think that one of the things is to ask for the support, right? If I'm having a hard time, I think that's the hardest thing for me to ever do, is to ask for help. And so really saying what we can do to help each other and how we can support each other is always a plus. So that's what I got.
Right.
Okay, so thank you, Sherry. Thank you so much. We do have a couple audience questions. So I do want to take one. I think it's a great question that relates to Housing First regarding how to educate landlords. So can any of you speak to what approaches you take to educate landlords so that you can ease this process of housing quickly? And is there any documentation specifically that you use to do that?
So my initial response was that I'm gonna pay you, but yeah, that's not I'm paying you, so stop playing. But that's just my initial. But no, we have really good conversations with our landlord having them understand them. What I encourage all my landlords to do is to go off Chicago's website. I give them the information. I tell them where to go. I also encourage them to become members. Whether they do that or not, I think that it's best that they are informed about who we are and the population that we serve and the other service providers that they can also get connected to. So that's one of the things that I tell them. And I've had landlords who tell me that they are going to do background checks. I said, that's fine. You can do what you want to do, but I'm not paying for it and my client isn't either. I just say that because that's not how we operate. That's not what we do. Our program is housing first. So if that's something that you want to do, that's out of the rent that I pay, and I stand firm on it. And so they may have some pushback, but at the end of the day, they still need that rent, and I need that space. So I guess I'm, got still a street in me from back in the day. So, but yeah, we really do what we work with. We have really great landlords, and so they may push back initially, but then after overall time, they just kind of conform and they understand it.
Yeah, I think that for Featherfish too, our housing locators are very good at developing strong relationships with the housing providers. If it's a new housing provider, they explain to them the population, the barriers that the population is going to come with. Like Sherry mentioned, they're probably going to have some kind of background issue. They're probably going to have been evicted at some point in time, or if not, don't have a real good record with rent paying. It's probably going to be a family with, 2 or 3 children living there. But we also try to assure the landlord that Featherfish is going to be there, that we're going to be there with the client, for the client, in support of the client. And in addition to Sherry telling them they're going to get paid, yeah, that's a very important, that's a very important factor. But most landlords are looking for more than that, especially today in the age of so much violence going on and everything. It helps. I'm not going to say they want that, but it helps to be able to give them some reassurance that this person is going to have some counseling, some guidance, someone there to help them over the rough spots, because there's going to be some rough spots. We're perfectly honest with our housing providers about who the population is. And strange as it may seem, we've had very good results in doing that. And we have housing providers that have recommended other housing providers to us. So we have a broad network. And it's a relationship building process. The same way it is with the program participant, you have to build a relationship with your housing provider. It goes hand in glove together.
Yeah, and I won't minimize it because they all of our property managers have all of our phone numbers, and some of them have them all the way up to the executive director. So they know that on a drop of a dime, one of us are going to come out and see what's going on. And so they're really confident about that. If there has been damage to property or anything like that, they know that they're going to call and we're going to make sure that we handle it. So yeah, really great relationships. So but I'm a little thug, so I go for the hardcore.
All right, well, that is a great note to end on. So I just want to say thank you again to Debbie, Betsy, and Sherry, and to Karen. You all have been fantastic. We really appreciate your insight on this really important topic. And just as a reminder, we are not having a webinar next week. We are changing the frequency of our webinars and our structure, but there will be another webinar on August 21st. So that's the current plan. And thank you all for attending today. There is a survey when you exit the webinar. So if you have a moment, please give us some feedback. So thank you all and have a wonderful day.
Thank you. Bye-bye.
Thanks, everyone.
We go to? Okay. All right.